Rolling, everybody rolling? Everybody ready? Just ignore the camera, obviously. And just so we have it on the tape, we always do this. Give us your full name, spell it, so we have it spelled correctly.
It's Kenneth B. Schwartz, S-C-H-W-W-A-R-T-Z.
I'm going to start this way by asking, do you remember the first time you met Dr. Lynch?
He was up against this beast, and there wasn't, from his point of view, it seemed like there wasn't enough time in the day to keep up with the cancer beast. He had some of the intensity and the ferocity of the beast he was facing. So it didn't make me uncomfortable. It made me feel that this was a guy who took this monster seriously. After all of the high-dose chemotherapy and radiation, I still had a spread of the cancer to my spine, a so-called metastatic tumor. I looked at him and I said, how do you do this job? And he said, by praying I don't have days like today. And he said, we don't have a cure at this time for this condition that you're in, which was hard for my wife and me to hear.
What do you want to do with the time you have remaining, whatever it's going to be?
I do want to continue, you know, if I've gotten a little bitty bully pulpit from this article, to try and send the message that we have to allow time to care. We can't be satisfied with mediocrity. And I think you need, you know, administrators who make this a priority and who say clinical care doesn't mean just taking care of an illness or a body. It means taking care of a soul and a spirit. And I think that signal has to come from the top.
Ken knew about medicine, he knew about policy, and he did worry that what he found to be so important in healthcare, that connection between patients and caregivers, would be threatened by systems which looked just at efficiency or just at throughput. And he worried a lot about whether or not we could maintain, enhance, and celebrate what made medicine special. And that connection between patients and caregivers was so crucial. I had the pleasure of moderating the first Schwartz Center rounds, which were held at Mass General. I remember the energy that was in the room, and I remember how nervous people were. Could this work? And we had several rounds that were, I thought, spectacular. And then I had the pleasure of going to St. Vincent's Hospital in Worcester. Very different in culture from the MGH, a smaller hospital. When I walked in and saw Schwartz rounds, and I saw the same energy, the same desire, and I saw how much the mission of the Schwartz Center resonated with the staff at St. Vincent's. That day, we knew that there was something special about the Schwartz Center rounds, and we knew that the Schwartz Center rounds would translate to hospitals throughout the United States, and now we're finding out throughout the world.
As a member of the Texas Health Foundation Board, Alan and I were interested in making a gift to the foundation.
But we were looking for something maybe a little more non-traditional. Dr. Bob Schwab has a reputation as a real innovator in Texas health resources, and he had mentioned Schwartz rounds, and both of our eyes, Lynn's and my eyes, both kind of lit up.
We just said, you know, we will help every hospital, which there are 29 of, we will help every hospital get Schwartz rounds started.
Because it was a chance to not just address physical needs, but address people needs, and not just across doctors and nurses, but across the entire spectrum of the 30-ish thousand people that work at Texas Health Resources, and to make a difference in their lives, and therefore make a difference in the system, make a difference in the care that the system provides to its patients, which is why the system's here to begin with.
There's good research that shows that compassionate care results in better outcomes. I think the program sells itself because the work we do is emotionally draining. We, doctors, nurses, tend to be people that don't share that very readily. We just kind of keep it inside to our detriment.
Alan and I did go to the first Schwartz rounds where we had a pretty wide range of folks there. And from talking with all those folks, you know, they just were like, this is the best thing that has happened to our hospital in a long, long time. And we were just kind of blown over, you know, to hear them talk about how much the Schwartz rounds had meant to them.
Schwartz rounds helps all of the staff recognize each other's values and contributions in delivering compassionate care to our patients.
For some people, it's transformational, I think, to know that they can actually do this and to know that other people feel the same way they do. Because they're embarrassed. I'm sad about this. I feel like I can't keep going. Everybody's thinking the same thing. They're just not saying it. So when you hear people say it, even if you don't say it, you realize I'm not in this by myself. People feel this way, and it builds teamwork. If you see a doctor crying about something, it's big. It's a big deal.
When your people are healthy, your retention goes up, your satisfaction goes up, the level of compassionate care that you provide goes up, the patient satisfaction you get coming out of that goes up. So the one word I would leave with you as an administrator is, this is a synergistic thing. It is a small investment that paid huge dividends, not just immediately, but over time.
For something that really pays dividends in terms of patient outcomes, which is why we're here. That's why we're here. I mean, everybody that works at the hospital either takes care of patients or supports people who do. And that's why we do this. And we know that caregiver well-being and compassion contribute to better outcomes. You're also going to get loyal, happy employees. And the cost of replacing employees is huge.
There's an old saying that says, seeing is believing, but some things have to be believed to be seen. Schwartz Rounds is one of those things that in its early stages you have to believe it in order to see it. Then when you see it, you go, my goodness, what a difference this has made.
It makes people better caregivers. It makes our hospital provide better care. It makes it a better experience for patients and families. And I think Schwartz Rounds is really an incredible thing. It's helped this hospital enormously.
I can say without question from our experience, it has made a world of difference for our system to be able to provide continuing compassionate care.
I think our administrators are some of our biggest champions now because they have seen what has happened with Schwartz Rounds at their hospitals. It's just fabulous. There's a difference between helping people and helping people with compassion in your heart also. With the Schwartz Rounds, these folks can give and give and give, but then they can come back and there's compassion being given to them by their peers. And I think that makes an incredible difference for their stamina, for their state of mind. They know that they have other folks to lean on. They don't have to be stoic. They don't have to go it alone.